to 55.
There are some delays due to the fog, so you can get the latest up on our website, power1017.com. And we go live to the hotline right now. I want to welcome Mary Mullins, the director of the Regional Cancer Care Center. Is it part of AGH? Are you guys working with AGH, Mary?
Yeah, we are part of the Atlantic General Health System.
Very good. Very good. AGH, proud partner of ours as well. So good morning. Welcome. We appreciate you checking in.
Good morning. Thank you, guys. We have another rainy start to the week, but hopefully sunshine the rest of the week, right?
Right. Hey, look, it's better than snow. I'm just saying. Well, look, we want to talk about Colon Cancer Awareness Month. You know, today is March the 1st, so tell us a little bit about it, what you guys are doing, and, of course, encouraging people to come in and get screened.
That's right, Bill. We are very excited to try to get the wheels started again for cancer screenings. They kind of shut down during the COVID pandemic, and even though the pandemic is still there with vaccinations, we're seeing our numbers decrease, and everything is opening back up. So our job is to get the word out, to get folks screening again, because screenings save lives. Mm-hmm. The earlier people get diagnosed, the better the treatment outcome. So it's very critical that people start looking at what their particular health risks are, what age groups they're in. Not sure if you guys realize, but now the recommendation is to start screening for colon cancer at age 45 versus 50.
Yeah, I didn't know that.
I was going to ask you, what like, you know, so even if everything's normal, you should still, you know, come in for a screening, or should you have like any kind of like symptoms, or how do you know to come in?
Right now, we're recommending that anyone at age 45 start your screenings for colon cancer and get screened every 5 to 10 years. So people who have a family history of colon cancer, have Crohn's disease, or type 2 diabetics, they're at higher risk and should possibly get colonoscopies or screenings more frequently. And the other high-risk factor is if you're African American. African Americans, while about 5% of the entire population is diagnosed with colon cancer under age 50, more than 10% of African American cases are diagnosed under age 50. Oh, wow. So it's critical to start getting those screenings at age 45. Not sure if you guys remember the movie Black Panther.
Mm-hmm.
Yes.
That? Yes. So he died last year from colon cancer at age 43. He was diagnosed at age 39, though.
Very sad. Very sad. I mean, it's scary. I'm 39. You know, it's scary just to think about it.
Yeah. And, you know, there are other options nowadays if you're kind of reluctant to go through the colonoscopy experience. There's the Cologuard. There are other types of tests that aren't quite as invasive to at least start the screening process. I always tell people something is better than nothing. Mm-hmm. We recently had a patient who he's now in remission from colon cancer, but he told me he was 15 years overdue for his colonoscopy, and he really didn't want to go through it. So he got the Cologuard, took the test, and was positive.
Wow.
So then he went and got, of course, the colonoscopy. He was at stage 4, and luckily he is now in remission. But again, he wouldn't have even found that out until he got that Cologuard screening. So again, some type of screening is better than nothing. Obviously, the colonoscopy is kind of the gold standard, but we'd rather you get some kind of screening.
How much of were people not coming in during COVID or during this past year? Was it like really bad, people not coming in for this, or, I mean, was it really numbers down?
So nationally, we're looking at screenings being down 80 to 95%.
Wow.
Screening, yes. So our big fear in the cancer community is that we're going to start seeing a lot of stage 3s and 4s instead of getting people when they're at stage 1 or 2. That's why I am my mission is to try to get the message out. Please start your screenings again. Yeah,
absolutely. And of course, this month is Colon Cancer Awareness Month. Now, if somebody wants to get screened and they just have no clue how to do it, what's your advice? How do they do that?
I mean, your first step is your primary care provider. Your primary care provider is who you want to talk to about your age group, your particular risk factors, and they can write an order to get whatever type of screening you're due for. And then the other thing I wanted to mention, too, guys, is that this Friday is Dress Blue Day for colon cancer awareness. And that was started by a volunteer from the Colorectal Cancer Alliance who was battling stage 4 colon cancer and felt like colon cancer was a cancer people didn't really want to talk about too much.
Mm-hmm.
So to kind of start the conversation, she got her group to dress all in blue. And then when people asked, hey, why are you dressed all in blue today? You could then talk about...
Oh, yeah, they could respond and say what it was about.
Exactly, Jessica. So we're encouraging, if you're part of an office, get your group together and dress in blue on Friday. Take a picture, put it up to social media, and give a shout-out to colon cancer and colon screenings, especially if you or someone you know has been impacted by that. I already have a blue wig on order that I'm going to wear Friday.
Oh,
Nice. So look, if you're in an office, this is something just fun to do, but get everyone, in the office to wear all blue, on Friday. Take a picture, tag AGH, and, talk to them about, colon cancer. Say you're doing it for colon cancer awareness. So, and get screened.
That's great.
So, absolutely. Again, this Friday, March the 6th, put those pictures up on your Facebook page. More than 140,000 people will be diagnosed with colon cancer this year, and 50,000 will die from, this type of cancer. And I mean, young. I mean, you start getting, tested, diagnosed young. So get in there. You said 45, right?
Absolutely. Yep. Start at 45 and screen every 5 to 10 years based on your particular risk factor.
And this is the same kind of cancer that Chadwick Boseman had.
That's right.
Wow.
And diagnosed at 39.
At 39. So young.
Passed away at the age of 43. That's very relatable. I mean, that's just unbelievable. And just coming off, his widow spoke last night at the Golden Globes.
She did.
We were just talking about that.
Mm-hmm.
So just unbelievable. Well, Mary, thank you so much for checking in. We really appreciate it. And again, if anybody wants any more information on this, do you guys have like a website or some social media people can look up?
Absolutely. Just look on the Atlantic General Hospital website. You'll find the Burbage Regional Cancer Care Center there, and we always have information up on our Facebook page as well. And feel free to just give us a call at the Cancer Center if you want more information on any type of screening. We'll be happy to provide it.
Very good. Mary, thank you so much for checking in. Have a great day, okay?
Thanks. You guys too. Bye.
7:53.